But welcome to our session today on designing work for care staff, what executives need to know. And thank you so much for joining us today. First, I'd like to acknowledge that I'm here today on the land of the Whadjuk people of the Noongar Nation, and I pay my respects to elders past, present and emerging. So my name is Professor Sharon Parker, and I am the lead, or I was at least the lead behind the Design for Care initiative that we're going to tell you a little bit more about now. And I'm delighted to introduce other members of my team. First of all, Dr. Lucinda Iles. Lucinda, if you can just wave. Lucinda is taking over as the lead of the Design for Care initiative as we move into a scaling phase. And we also have Jie Yang, who is here today and has been helping us get all this material that you're about to see organised. So let me share with you what our plan is for today. What we're going to do is talk a little bit about psychological injury, what's happening in the sector. Then I'm going to talk about smart work design as one way of addressing this challenge, including some of the ways in which you as leaders can help in driving change towards smarter work design, and then talk about some opportunities in the sector for leaders that we would very much like you to be on board with. But before I get going, I'd love to, we don't have time to introduce everyone because there's quite a few people on the call, but I would love if one or two people could just show their face and unmute themselves and just share who they are and which industry they're from. So is there someone here from the disability care sector who would be willing to just put their camera on and tell us who they are and what brings them here today? So I'm just going to hope somebody does that. Otherwise, I'm going to randomly pick someone. Let's check you're all awake. Okay, I'm randomly picking someone. Belinda Moore, I don't know if you can hear me. Would you be happy to just share who you are and what brings you here today? If you don't mind unmuting yourself. Just wondering if everyone can hear us. Lucinda, can you hear me okay? Yeah, okay. Well, look, maybe we will just kick on. And it may be that we're having some technical problems with people doing that. So let's not hold ourselves up. Oh, we don't have the option to unmute. Thank you, Zana, for sharing that. But we don't have control of the mute. You should actually be able to just talk, but look, let's move on. Sorry about that, technical issues. I would have loved to have just heard from you, but we will move on and we'll make sure we resolve that, guys. If you can think about that, Jay, before questions, because we're going to need people to be able to unmute. But let's just start with a little bit of context about this sector. And this is a workforce, the care workforce, that you know better than anyone is a workforce under pressure. And this is a quote from one of the care workers that we did research with and interviewed. You know, the priority has been about survival instead of thriving. And I guess we see that fact that this is a workforce under pressure, and I suspect it includes leaders as well, in the data around workers' compensation cases for psychological injury. So a few years ago, one of our colleagues, would you be able to share the slides? Yes, I will share the slides later. Very happy to do that. One of our colleagues, Professor Alex Colley from Monash University, analysed the number of workers' compensation claims for psychological injury in the sector and compared it to other sectors. And that light blue line at the top, the one that's going up, sort of quite steeply up from about 2014. That's the line for the healthcare and social assistance sector. So what you can see, first of all, is that the number of claims per 1,000 workers is on average higher but also that it is increasing. And I suspect this ends in 21. I suspect that that number will be quite a lot higher now with all the awareness of the issue that's around. So this is a challenge that's not probably going to go away soon. And if you look at these claims, these workers' compensation claims for psychological injury, what are they about? Most of them are about harassment or bullying. You can see 34.9%. What's interesting, actually, there's been quite some research done. Quite often, harassment and bullying is a bit of a reflection of a workforce under pressure, because when people are overloaded, rushed, stressed, this is when often conflicts can bubble to the surface and then become dysfunctional. So bullying often is a reflection, actually, of poor work design. The second big category you can see is just straight out work pressure. So workload, emotional demands, these sorts of pressures. And then the third one is occupational violence. So when a client gets violent, or in some other way a worker is exposed to violence. So one of the ways forward, and this is not just us saying this is decades of research, including some work that we did with Alex Colley, looking at what are the main factors that reduce workers' compensation claims. One of the most important solutions is work design. And work design is really about how your tasks are organised, what your tasks are, people's roles and responsibilities, their decision making, for example, and also the relationships that people have with others. And if that's not clear, I'm going to unpack that a little bit more. So our Design for Care project was all about bringing this area of work design into improving work for carers, with the ultimate goal of improving mental health and with a longer term flow through to those workers' compensation cases. So one of the things that Design for Care is based on is a model of work design that I and other colleagues have developed, which sort of synthesizes 100 years of research around what is it that psychologically, from a motivational and a mental health perspective, really matters for workers. And the first thing is stimulating. So this is about having work that is interesting, meaningful, challenging, with a bit of variety. The second component is mastery. This is about the importance of going to work and actually being clear what it is that you are meant to be doing. So having role clarity, you may have heard that word, but also getting feedback on how you are performing, and understanding where does your job fit in the bigger picture of things. A is for agency, or sometimes we call it autonomy. This is the importance of being able to actually shape and influence and control your work world. So have some influence over decisions that are made, how you do your work, when you do your work, these sorts of components. R is for relational. And I always like to say this is something that we sort of all discovered during COVID, because people were working from home and suddenly everyone was like, oh, I miss that connection with my colleagues. And this really taps into a fundamental need that humans have, which is to belong to something or to connect with other people. So relational work design is all about creating work where there's a chance to connect with other people and get support from them and be part of a team. And then T is for tolerable. And I always like to say this is the big one, insofar as in many contexts where we work, many sectors, not just the care sector, workers are facing demands that they don't find tolerable anymore. So these demands might be emotional demands, they might be just the pressure of doing a certain workload within a certain amount of time. They might be cognitive demands, they might even be physical demands. but whatever demands people have in their work, they need to not exceed people's ability to cope with those demands. And that's what we mean by tolerable work. So, as I've sort of mentioned already, there are decades of research linking these aspects of work design to mental well-being, first of all. So things like anxiety, depression, psychological distress at work, but also really important, also predicting motivation and performance. So if you're able to create smart work design, then that also is more motivating for people, and they're more likely to be creative and innovative and put in, their optimal level of effort. And then finally, these aspects of work design are really important from a learning and a growth perspective. If you've got stimulating, challenging, interesting work, you are going to be learning and growing much more, for example, than if you don't. And that, of course, is really important in the era of AI, where people are going to need to learn continually to succeed. And we can sort of recognise, we sometimes talk about a mental health spectrum. And when we talk about mental health, we're not just talking about the prevention of ill health, but we're talking about the promotion of states like thriving and learning and growing. So let's have a look at what this looks like in the healthcare and social assistance sector. And this is data that was based on a survey that we did in the sector a couple of years ago. And we surveyed several thousand care workers. So what you can see there, this shows the percentage of respondents that agreed that these aspects were present in their job. So if you look at stimulating, it probably will not surprise you that actually, nearly 2/3, I think, of people finding their work stimulating, interesting, challenging, etc. So that's not so much an issue in this sector. But what you can see, and you can see the relational is not too bad. It's a bit mixed. Actually, some people have great supportive environments and others don't. But where the issues are on average in the sector, and this is on average, it's around mastery. We especially found that people struggled with role clarity. And I think sometimes it wasn't so much not knowing what to do, it was knowing which of the many, many things they should prioritise. So that sort of aspect of mastery came to the fore in many of the interviews and so on that we did. Agency also comes out as an aspect, and sometimes that is about the sector itself. People it's very hard, even I think for leaders sometimes, to have a voice, have agency around the policies that are implemented and so on. But even just locally, sometimes people are feeling they don't have as much agency and autonomy as they would ideally like. And then you can sort of see the big one, that people are not feeling that their work is tolerable. They are feeling that there are many, many demands that face them. We actually asked you this question when you registered, you may recall, to say what you see as the issues. Oh, hang on, I'm going to come to that slide in a minute. Sorry, I just wanted to also show you this slide, and this is from the same data set. If a lot of the time when people and we see this, leaders are analysing burnout and these sorts of things, and they say, well, who's burnt out? Which age groups? Or is it people on temporary contracts? Or is it men versus women? Or is it the young people, the low tenure people? Who is it? If we look at those sorts of things, that explains about 6% of the variance in burnout, which is a significant amount. In other words, if you know demographics, you're going to be able to understand burnout and who experiences it to a degree. But what you can see here is that much, much more important are those smart work design aspects. So that explains 46% of the variance in burnout, which is sort of statistical jargon, and sorry for that. But it just means that if you know people's smart work design, you're very going to be very good at predicting whether they are going to experience burnout or not. And it's much more powerful than knowing what age they are or what contract type or whatever they are. Oh, yes. And here's the one I was starting to talk about before. So we asked you what you saw as the biggest work design challenge in your organisation. And this is just a very simple word cloud. You can see high workload is the biggest. And in fact, workload and overload, if we combine them, they'd probably be even bigger. But you can see things like emotional demands. So again, that's part of that tolerable. High workload is part of the tolerable. Exposure to constant change, again, part of what makes work feel intolerable. Administrative burden, and so on. Psychological safety. This is one we'd probably put in the relational category. This is really about, do people feel they're in a supportive team where they feel psychologically safe to put forward their views and opinions? And you can see other things there. So thank you for doing that. It really dovetails very well with the data that I've already shared with you. So I want to now, just in the context of all of that, talk a little bit about Design for Care Phase 1, which is something we've been working on for about 5 years. And now we're in Phase 2, and I'm going to tell you about Phase 2 and the opportunities that has for the sector in a moment. But I want to just repeat, if you're not familiar, what Design for Care Phase 1 was all about. So as you can see there, the goal was really to understand the work design and then to try to redesign and implement and evaluate work redesign. So a change in the work design to ultimately promote mental health and prevent that psychological injury where we saw as a big driver of workers' compensation claims. Our focus was New South Wales, and our focus was the healthcare and the social assistance sector only. What did we do? We used the smart work design as a model, so that's sort of the what. But when you're looking at work redesign, the how is just as important as the what. We realised that this is a sector with incredibly high demands and an awful lot going on. We did not want to be trying to implement yet another change that was a top-down change that was done to people. So instead of that, we adopted a participatory approach to change, which was, in other words, we created a way to involve the people in the jobs, the carers, to redesign the work themselves in a participatory way. And we thought that was really perhaps going to be the best way to get ownership and traction of the change. We did this as a pilot initiative in 8 different healthcare and social assistance organisations. What is this participatory approach? I've shared with you what the smart work design model was. So what this is, it's a sort of path. We talk about it as the path to work design. And P stands for lay the foundation, so prepare. And this was really, usually we'd get together a little team, work out who would be in the team. There'd usually be some workers, sometimes a manager, sometimes not, sometimes a HR person, sometimes not. So we'd work out in this organisation, what is a team that could work on redesign. Then we would do some sort of assessment. So this means let's understand for this organisation, what are the work design opportunities, strengths, and what are the challenges. And so sometimes we would do that across the whole organisation. Sometimes we'd just do that in parts of the organisation, again, dependent on the particular situation. R is for reflect. So having carried out a survey, having done some observations of the work, having interviewed people, having talked to leaders in the organisation, having looked at documents, whatever made sense from an assessment perspective, we would then reflect, which really means pull all that together and reflect it back to the leadership team, but also to the carers, the workers. and make sense of it, I guess. And from that, really prioritize where are some areas perhaps to do some redesign in this co-design way, so involving the people in the work themselves, and what might that look like? So this would be a process. I always talk about it as a process of divergence and convergence. Divergence to think of all the different ideas and options, and then convergence on a couple of tractable options that could actually get implemented. And then the T in the model is to track, which is to say, does this actually make any difference? What's the impact? So it's sort of repeat the assess phase to see what happens. And then H is habituate. And this is to recognize that if we've been working on a pilot, it makes sense to then say, okay, how can this change be spread? Or are there some broader changes perhaps to HR policies, or perhaps to something, other policies in the organisation that need to be put in place so that this change will actually last over time? So just to give an example of that, and was in a disability care organisation. We did the prepare phase, so we get the buy-in, get stakeholders involved and so on. Then we did surveys and interviews, which revealed that the demands were not very tolerable, especially around emotional demands and workload demands. But that was even made worse because people were not especially clear. So there was that lack of role clarity. They felt they didn't always have the autonomy, the agency that they needed, and sometimes felt a bit isolated and unsupported. So that was the assess phase. Then we go into the reflect phase, so presenting those findings back to the leadership and the teams, making sense of those findings. Then we ran we had 3 different units that each had 3 workshops to understand work design. So in those workshops, people would learn about the SMART model, and then they try and look at the root causes of some of these problems, brainstorm solutions and come up with an action plan. And then, of course, we implemented the changes and actually followed up to see what impact they'd had. And in some cases, we got to habituate. In other cases, we left that to the organisation to work on. So just as an example, and I want to emphasise these are the solutions the teams came up with that they believed would make a difference to their work design. So just as an example, in site 1, they recognised that they needed to make these adjustments to the rostering. So the rostering was causing demands. So they made some adjustments to the rostering. They also recognised that there's a lot of compliance and administration and record keeping that they were not getting time for, and trying to juggle it with the care needs was very stressful. So they created a system where people could have some time off the floor to get that work done. In the second site, they focused a bit more on the relational aspect. So I mentioned before that a lack of support was one of the challenges. So they developed this philosophy, there's no I in team. They got people to share who they were when they were on call, and created a system where if they needed help, they knew who to go to in HR. And then in the third site, they introduced a sharing is caring sort of system, and a big day, Wednesday, I think it was a social day or something, I can't quite remember. It doesn't really matter what these specific things are. The point is that these were solutions that the carers came up with themselves with the support and endorsement of the leaders. This is what really matters and what I really want to emphasise, which is, as I said, we tracked the impact of these changes. So what you see here is burnout. The blue line is people who were not involved in that change that I just talked about. What you actually see here is that the burnout for these people increased over time. And, we knew why, because there was more change introduced in that organisation, and that was really making people's work more difficult. But what's really important is you see that for those that were involved in the intervention, you see that the burnout has significantly decreased. And if we look at unpacking that data even further, the business as usual teams had the intervention teams had more tolerable demands over time after the intervention. So they experienced less time pressure, less role conflict, and less work-family conflict, which is great because I've said already that tolerable demands is the big one, and is often the thing that's really driving those workers' compensation claims and so on. So we see here this reduction in demands to make the work more tolerable for the intervention group. We also see that significant improvement in mastery, so people feeling clearer about what they're doing. They got specifically in this case, they're feeling they're getting more feedback. And then you also see an improvement in the relational aspects of work, so that support, you can see increased co-worker support, so they felt they were supporting each other better, and more psychological safety, so feeling more able to voice concerns, to be themselves at work. And then, as you can see from the figure, but also from the statistics, a reduction in burnout in the intervention group. This is just one of our cases. Of course, there are others, but I wanted to just share what it sort of looks like for one organisation. So what you can do as leaders, I guess, in this process, and this is the process that we now want to try and roll out and involve more people in, is that you can be visible and supportive, I guess, of this sort of initiative. And we'll talk more about what that looks like from a practical perspective. But sometimes if people are on the front line with their leaders, are working really hard to introduce new initiatives and so on, just showing a bit of interest, sometimes helping unblock roadblocks that occur, can really make a big difference. Providing resources. So one of the biggest challenges in the pilot was getting time for people to participate in the activities. So one thing that leaders can really do is support people getting that time. I think that we know from the research that you get success when people are involved in this redesign process and they feel psychologically safe and they feel able to share their concerns and worries and not be concerned that they're going to be punished if they raise tricky issues and so on. And I think as leaders, role modeling and setting up a culture of psychosocial safety is important. And that really comes down to just listening and acting. We think that one of the reasons this initiative was successful was because it was very much a bottom-up initiative, and it's not about what managers and leaders think matters. It's about doing what staff think will make a difference to improve their work design. That leader support that I've just talked about actually matters. So in one of our studies, again, this was in a disability care organisation, what you can see here is that the group that actually improved on their thriving with the initiative were people who were part of the intervention and they had leader support. These other lines here were groups that were not part of the intervention. So actually, again, you see thriving going down over time, but also what you see in this pink line is groups that were part of the intervention. So they were involved in this process that I've just talked about, but they didn't have that leader support. And you can see that things don't necessarily get better for them. So leader support is a really important part, I guess, of getting the success. So even though it's a bottom-up intervention, people need the support of their leaders to make it happen. And now we're going to go into a second phase. And I guess off the back of interest in the initial phase, and some of you who are coming along here today might have come to some of our Design for Care events that we held in Sydney. where we shared not just this case, but other cases and other examples. Because of that success, we're now going further with a second phase for the project. And I guess we wanted to engage our senior leaders today, our executives, because in that Design for Care pilot phase, our senior leaders really got on board and found it valuable. So you can see here's a senior leader from one of our pilot organisations saying this approach, the Design for Care approach, was especially powerful as these ideas came directly from our employees. Staff have expressed appreciation for the chance to voice their concerns, share ideas, and actively contribute to changes. So have that autonomy and directly enhance their well-being and workplace environment. You can see another comment from a CEO of one of our organisations. We see this as not really the end of the project, but really the beginning of our workplace wellbeing journey. We know that we've got more work to do, and we've learned a number of things along the way by working with Design for Care. So we, in our successful pilot organisation, senior leadership was really, really important in the process. And so this is why we want to invite you to come on that journey with your leaders. And just to share, you know, I think this is a particularly powerful quote from a carer. So you've seen the sort of quantitative data. Here's some more qualitative data from the interviews. So a carer said, I just used to get a kind of panic before the redesign and feel like, oh my God, there's too much. I can't handle this. I used to get panicky. But now, you know, I want to go to work. At least I know there will be support. So what this quote really nicely shows, I think, is that sometimes the demands are still there. People have still got a lot to do. And that doesn't necessarily change. Of course, we can try to change that, but sometimes the demands are still there, but people feel more supported and they feel clearer. And that really makes a difference to people's mental health and well-being. And so that brings us to our second phase. And I'm going to hand you at this point to Lucinda, who is leading this phase, and she's going to tell you about the different options that exist. So over to you, Lucinda, and just tell me when you want me to move forward.
I will. Thank you, Sharon. And thanks everyone for joining us today. As part of our next stage of the process of Design for Care, we've had to think about what are the best ways that we can give the industry the resources it needs and the knowledge it needs to be able to do these work design changes themselves, rather than relying on us, the research team, to drive the redesign process. We've really had to think about what are the tools and resources that you might need to be able to start on your work design journey. And delivering those tools and resources is what our next year or so of Design for Care looks like. So there's two main ways that organisations can get involved. The first is the Smart Fundamentals program, which will be an online training program that is targeting frontline workers and frontline managers. The idea of this is that there will be under an hour modules that can give frontline workers the information that they need about work design, so they can be conscious of work design in their day-to-day work, and start to build that familiarity with the concepts of work design, so that future initiatives have a common language and a common baseline understanding. So we've developed this to target frontline workers and managers, and that is designed to complement our Leading Work Design Change Masterclass series, which is a deeper guided training program that we have developed that is designed for your HR, work health and safety practitioners, or senior leaders to learn how to redesign work with support from us, from the diagnosis process to the implementation. The idea, Sharon, if we could go to the next slide, I might be able to. Thank you. The idea is that we want to, across 5 interconnected masterclasses, we want to provide the industry with some practical tools of how to implement the path process in your organization. So the way that we've structured it is that whilst you're learning across about a 6-month process, you will learn from us and then you will go and apply what you've learned in your organization. Then you'll be able to come back, reflect on what went well, what didn't go so well, share your experiences, and then get ready to learn the next stage and apply the next stage. So we really wanted this to be a practical, applied process that organizations can go through, so that you're not just learning something that you learn it for 2 days and then you never get the chance to apply it. The idea is that you will really strengthen your professional toolkit with some evidence-based skills. So the people who participate have the chance to really develop their work design change skills and support their career growth. You'll also get to learn from us and learn from the experience that we've developed across the pilot process from the phase 1 of Design for Care. And you'll get lots of knowledge that Sharon and our other professors have built up for us as well. You'll also build a lot of connections with peers across the industry who are navigating similar challenges. We've designed the program so that it has a really collaboratory peer learning process, so that as you're going through the process, you can share what you've learnt across your years in the industry, and you'll get the chance to learn from others who are going through similar things. And as I said before, applying what you learn in real time to create systemic change as you go in that supported, guided way. Our first intake of the Masterclass series will launch in October, so it's coming up quite soon, and we're still taking expressions of interest for participants. They are filling up fairly quickly, so please do let us know. At the end of this, we've got a QR code that you'll be able to fill in your interest if you would like your organisation to sign up, and Jay and I will be happy to reach out to you and give you a bit more information on what might be involved and whether or not it's right for your organisation. It will be held in person at the University of Sydney Business School, just as a way that we can really facilitate that, that peer learning process. Sharon, I think we can go to the next slide and have any questions from the audience.
Thank you, Lucinda. So yes, so that is a little bit of background and what's up next. Yes, Emily, love to hear your question. Please go ahead.
Thank you very much, Sharon and Lucinda. Great presentations. Two questions. One is what the time commitment was roughly for workers for that redesign processes, or what the range was, because I think for managers, that's what they're always interested in. And the second was just whether the Masterclass series, if there's a charge for that.
I can answer those. In terms of time commitment, I think it was very varied. We did our best to reduce the time commitment as much as possible, but we also found that it was really important that employees had ways that they could provide feedback. So that might mean there are other ways outside of just doing the focus group. So finding, having suggestion boxes and that kind of thing, so that you're collecting data from other sources on their pain points and where things are not going so well. But we found that that divergent and convergent process happens best through discussion. So each of those workshops that we did were about 3 hours long. So across the 3, it was about 9 hours of frontline worker time. But the process of implementation would kind of depend on what the actual changes were.
Yep. Okay,
And
thanks.
then the other question,
Was
remind
just
me
about
again what your other
cost.
one? Oh,
Oh,
It was
cost.
just about
there's
cost
no
of the design.
cost.
No
Oh,
cost for
fantastic.
eye care insured organisations. There's no cost.
Yep. Okay.
Yeah.
And I presume LHDs are eye care insured, is that correct?
I
Local
don't
health
know.
districts? No.
That might be
Okay.
one to check with your team. You
Yeah.
do have to be a health and safe, sorry, not health and safety, a healthcare and social assistance industry. So have some kind of involvement in the aged care, disability care, child welfare kind of industries. So we're not taking hospitals so much as those more care oriented
Okay,
organizations.
that would exclude us. Okay,
Yeah,
thanks. It's good to
sorry.
know. That's
But
okay.
Emily, I guess one of the other things we're doing as part of the journey, it will sort of be phase 3, is more of a train the trainer. So that once we know we can get this approach to work, training people in being able to run this so that it's again not dependent on us. So there is potential to expand beyond us. But I think, Barbara, you had your hand up. I don't know if you're still there.
Yes, I am. Hi.
Yeah, jump in.
I was just wondering how you go with balancing the work design for care staff in the field with person-centered care. Like how does that sort of come into play?
I don't think that they're mutually exclusive concepts. I think the idea is around looking at ways that you can enable staff to provide that person-centered care. So do they have, for example, thinking about mastery, do they have all the information that they need about that participant to be able to provide the care that they need to be able to provide? Often we found that things like role clarity were lacking, or handover notes weren't quite as comprehensive as what they could be, which then made it difficult to provide the quality of care that was required. Then if you think about things like agency doesn't mean that that carers can completely do whatever they want. It's we always say it's agency, not anarchy. So part of the process of providing agency in this industry is figuring out with the participant what would work well from a workflow perspective. But it's kind of more around trying to avoid imposing very strict methods, very, very strict time points that things have to be done in ways that contradict the best care for the participant.
And Barbara, if I could
Right.
just jump in
Thank you.
as well. Yeah, I would say whenever we're talking about redesigning work, we always approaching it from 2 perspectives. One is how do we make smart work for workers, but how do we also deliver the goals of the organisation, which could be person-centred care, or they might be efficiency, or they might be a range of goals. But it's always those 2 things in parallel, because it's not going to be a good and sustainable work design if it's great for workers, but it's not delivering the goals of the organisation. So and that's part of that workshop process, is educating people about that. It's also partly why the managers are always involved and get an opportunity to say if they think it's going to cause problems with delivering goals or so and so. So there are a few. There are some. I guess it's not, as Lucinda said, it's not just free range. There are some constraints around the process to make sure that it's meeting the organisation goals as well.
Lovely.
I think
Thank
also
you.
one more thing I would say to that is that what we found in the workshop processes is that most of the staff wanted to be able to provide the quality of care, and they were finding that systems and the way that the work design was set up was a barrier to being able to provide the care that they wanted to. And that was often something that was driving a sense of burnout and exhaustion, was fighting against the systems and processes that don't work to be able to keep meeting the standards. So sometimes removing some of that red tape can help provide the care that you want to deliver for your participants.
Paulette.
Thank you.
Yeah, thanks, Barbara. Paulette, do you want to jump in? I think you've accidentally muted yourself.
Yes, I had. Sorry. Hi, thank you. I jumped in late, but I love your work and I've been following it for a while. I'm really curious as to how you engaged with leaders in terms of the support for workers to participate in the work design. That feels for me like quite a challenge, helping them recognise. It's a kind of a bit of a slow process probably in their minds, but oftentimes there's not enough time for workers to get their head around an impending change. But then I've kind of tried in my own way to work backwards and go, well, let's engage the staff here, but kind of getting them to really trust and quarantine the time to put aside to get the workers' input and then gather some more information and then come back, over the process will help in the, eventual outcome. I'm just really curious as if you found any kind of really smart and clever ways to do that.
I suspect there's no substitute, Paulette. I wish there was a super quick and easy way to do it, but that's sort of why we're saying that those 3 workshops are almost a bit of a minimum, which sounds like a lot of time, I know, to people, but because it is a process of building trust, creating safety, that people feel safe to speak out, analysing the situation, going deeper, because we try to get more to root cause if possible. So that, and there's sort of no substitute really for time. So I don't know, Lucinda, have you got any magic up your sleeve?
Sorry, did I just cut you off?
No, sorry, I was going to jump. I was just kind of wondering if it was around the communication of what was coming back, if it was around kind of keeping that all front and centre, if that helped.
Yeah, I think there's a couple of things that we have found useful. I think the first is figuring out what is the right lever for your leadership team. Are they motivated by the compliance side, because designing healthy work is part of their expectations legally, or is it from a providing better quality care side? So figuring out what is the, business case that's going to be effective for your leadership team might be one place to start.
Yeah.
And then sometimes it's also about finding a team where you can get some early wins on the board. So if you've got a team that maybe it's a little bit easier to get on board with, a manager that's a bit more open to experimenting, having a chance to have a little bit of a case study within the organisation and show some early success can be useful as well.
Okay.
We also found that through the process, we were very communicative with all levels. So keeping people updated on the process, updating on themes of the workshops without being too explicit, like finding the aggregating what are the main themes that people are observing, what are some of the ideas that people are coming up with, is useful so that they kind of know where things are at, and it feels like a productive conversation as opposed to just a place where people can come together and complain. And
it sounds really
sure
generative.
Yeah, exactly. And we found people were very sensible in the suggestions that they made, and often leaders find that really reassuring as well, that they're not asking for, we need all these more staff and all these resources. They're practical, sensible changes. So I think sometimes it's just slowly changing.
And again, it takes a bit of time, I think, even because initially it's always like we need more staff, we need, and we have to get beyond that sort of, because that's not going to be a solution. And I think it also helps just sharing little case studies of what other places have done, and people seeing that we're not talking rocket science, these small things, it can be just changing the roster system can make a huge difference, you know. But so sometimes those small wins are not always easy to achieve, but just get that momentum and trust in the process.
Yeah.
And that's why we had people at the end who were keen to keep going, because they sort of realized that, yeah, there's actually a lot of good ideas that can be unleashed, I guess, through a process like this. Yeah.
Well, it sounds like it just provides an opportunity for people to maybe articulate things that they've been thinking about but not really found words to say. That's what I'm kind of hearing, that it's, and which is moving away from that.
Yeah, they're going through this process every day, right? They're fighting against red tape or things that don't seem sensible. And they're probably mulling it over. And if we just did it this way, it would be so much faster and I could do what I needed to do. But they don't always have that pathway to voice those ideas. So it kind of just gives that space to voice that. Yeah.
Yeah, no, that's really exciting. So thank you, and thanks for the answers.
Thank you. Thanks, Paul. And I think Barbara has another question. Do you want to jump in, Barbara?
Yeah, hi. I'm sorry, it's just more a logistical question. Do you know when the next round or opportunity to do this will be? I know October is a full month, so I know that won't be possible for me. Is there plans for a next one?
There is plans for a next one. We're not 100% certain on the date at the moment. We're thinking November, but it might be a little bit flexible. So if you are interested, if you still fill out the expression of interest form, so we have your details and we can chat to you about the oh, thanks, Sharon, the date.
Will do. Thank you.
Am I sharing the right screen there?
You are, yeah.
Yes, cool. Yeah, so yes, so we realise there's lots to reflect on and things with this. We're hoping to do more than this one, but yeah, if you express your interest and get your name on the list. I think also just to be clear, you're all diverse and from different levels and so on, but we're also in terms of who might come on the program. Lucinda, would you say a little bit about that? Because we're not necessarily expecting senior executives and leaders to be coming on the program. We're looking more for frontline, right? And people in those roles, change sort of roles, right?
Yeah, so we're looking for more people who are in the people and culture, work health and safety. We've had some people in the kind of quality assurance types of positions. We are recommending that each organisation have 2 people, if possible, attend. And we've done that for a couple of reasons. The first is so that you've got a bit of support as you go through the process and the implementation process, but also in case someone's sick or unwell, can't make it to one of the sessions, then you've got someone who will still be able to access that information. But it's really about who would be responsible for driving this change process. So,
and in smaller organisations, though, Lucinda, that might be a frontline manager, for example, right?
It could be, yeah.
Yeah. And so just to be clear, I guess what we're asking for is for senior leaders, executives to be supporting this process, maybe mentioning it to people they think might be relevant in the organisation. And then if those people sign up, being there in the background as a support, I guess, and helping in the way that we know really matters. So just want to make that clear, I guess, that there are those different roles. But some of you might be the sort of people we're talking about. So we just have a diverse group on the call. Yeah.
We have been having about 30-minute briefing with people who are interested in expressing interest. So if you do want your organisation to sign up or be involved, put your expression of interest and we can talk about who would be most appropriate for your organisation and figure out that correct role with you so that you feel comfortable with who would fit and who would get the most out of it.
Yeah, because we recognise some organisations here have got 5,000, some have got 50, and it's very, very different according to size and also the type of care and so on that's delivered. So,
Yeah.
Right. Well, look, I think we're coming close to the end. Is there any more? Just give one more chance for any last questions. But if not, thank you so much for joining us. We've had a terrific number of people interested, which is just fantastic from our point of view. You've got the expression of interest there, and I think we've probably asked you for a little bit of feedback. That just helps us keep getting funding for this work, so it's important for us. But really, as Lucinda said, if you're not at all sure, you've got more logistical questions, we're really happy to have those one-on-one conversations with you or your team or whoever is appropriate. So don't hesitate to reach out and let other people in the sector know as well. But thank you again for taking the time to join us. We know that your time is precious and we respect and appreciate that enormously. Lucinda, is there anything else you want to say before we sign off?
I don't think so. Thank you everyone for joining us.
Yeah, terrific. We're giving you back 3 minutes of your time before your next meeting. Thank you all.
Thank you.
Thank you.
Yeah.
Thank you.
So I will stop sharing. Just check in the chat.